Well, I constantly have a right hip that goes out with scoliosis, and I have to have a chiropractor adjust me pretty frequently. Otherwise, it starts feeding down into possible sciatica, knee pain, and even pain when I'm sitting. It's pretty constant. I live with it. It's about a level 5. Constantly I can go on walks, but then I have to stop and stretch my quads. They tighten up on me. So it's a nuisance. I can't exercise like I used to enjoy taking kickboxing classes or ballet, because the hip prevents that, and that is a major loss for me. Plus, if I stand for long periods of time, it radiates pain up my back and down my spine into my legs. Well, it gets up to about an 8 or 9 before I'll see the chiropractor, since I'm used to living with it. But if I allow it...
How often is that you had to go see a chiropractor?
Oh, about once a month, every other month. Go in and have him adjust it, because otherwise it affects all the rest of my muscles and bones. The second thing is fatigue sometimes, because I don't feel like I get a good quality of sleep. I have to lay on my right side a lot of times because my left side sinuses get stopped up, and so then I have to have a pillow just right between my legs, and I probably snore and don't breathe well, and so when I wake up in the morning, I feel like, gee, even though I've slept 7-8 hours, why am I getting up tired? And I take coffee in the morning to, get me alert. I just feel groggy and tired unless I do that. And then right around 2 o'clock in the afternoon, I feel like, oh gosh, if I don't do something, I'm going to want to really fall asleep and take a nap, because I can't seem to keep going. So a lot of times I'll force myself to, tough through it, and sometimes I get, enough to keep me going in the afternoon. But other times, what helps me in the afternoon is to rest my mind, which helps with meditating. In the mornings, sometimes it can start as low as a 2 or a 3. To where, I can get up because I'm used to forcing myself to get up, but I'd really rather just go back to sleep, but I can get up. And then the third one, my sinuses have consistently been stuffed up. It can be through here and through here, and if I use some nasal saline spray and possibly even some Afrin type of spray that gets the tissues from being inflamed and keeps the flow of the fluids thinned out. Otherwise, if I allow it to, it can actually flow over, and I can get ear congestion. I do have allergies, which sometimes I take antihistamines for. And then the fourth thing that I always have, because I'm anxious in general as a personality. I was a computer programmer, so the brain would be so busy with that it can exhaust itself, which is why the meditating is good. But and yoga is good for that as well. That's probably 5, where I just get used to, in the background, in the subconscious, the mind might be mulling over things that it needs to plan for ahead of time. But it can spike if I have an event that, we all have in our lives, a family illness, and that can spike up to, a 9 or a 10. Well, I have taken for granted that's how much better I'm feeling. I used to drive around with really sore entire left side. It would start here, go down my face, in my neck, and into my left shoulder. And sometimes my left shoulder would go numb. And that is, I just get up every morning and it's amazing how fast you can take for granted how good you feel. Well, as my upper palate has widened, it's given me room for my tongue. And I wrote in a note to you all in my update that sometimes at night before I had all this done, I used to stick my tongue out. I'll hold it like this, and just to see what would it feel like to open up that passageway. And that does open up the airway. It feels like there's just more room somehow in even a nasal and sinus area to have the airflow so that it doesn't clog up. Mm-hmm. And even the positioning of my jaw seems to be helping my left sinus. Therefore, I sleep better because I'm not up at night worrying about, oh my God, am I coming down with a sinus infection? So feeling better all the time helps anxiety. And the hip is better. I was going to the chiropractor, probably should have been going more than once a month. And everything is in proper alignment and properly supported muscularly. To where that SI joint is no longer as unstable as long as I do my exercises that I didn't know about before.
What did the chiropractor used to have to do monthly?
Every month I would lie on my stomach, and he would push, sometimes with the hips raised. He would kind of push on that, and then you'd roll onto your side like this, and he would shove that hip back in. And then, I'd have to go home and take a leave because that's very painful. And it was treating a symptom. It is, yes, okay. As long as I do my exercises, which, that's a small price to pay. 99.99999%. As far as improvement, mm-hmm. Well, I would say, like I said, 99.9999%, 99.9, I mean, same, I sleep better, I can get right out of bed, whereas before it used to just be very difficult. I wanted to go back to sleep because I hadn't slept well. The airway seemed at night, the problem at night was, when you lay prone, sometimes that makes things a little bit more stuffy. Has it been about 3 months? Yes.
So, can you grab that one and show it to us?
Yeah.
That's what you have.
Yes. Yes.
Then how do you get along with it?
I adjust it myself fine weekly, and I do, when I have it in, tend to have not as clear enunciation.
There's a lot of stuff in there.
Yeah, right. But otherwise, I just go about my business daily, and it doesn't affect me, I would say 99.99%, when you're not concerned about, am I going to wake up with, because the chiropractor also had to adjust my neck. I am going to be 64 in February. I was worried about that. I personally was worried about that, but you know what? If there is a methodology to do it, the jaw seems to be moving quite well. As a matter of fact, it does feel as though I have a little bit more symmetry. I'm not certain that's correct, but it feels as though it is correct, because my face was really asymmetrical. The right hip, I was constantly having to go to my chiropractor maybe once a month and have the hip literally put back in place, which was painful and frustrating. I haven't been to the chiropractor in a year because I am aligning, and the hip is staying in, and the body posture is less painful. So I have been taking, again, I mentioned the last time that I kind of taking for granted how much better I feel. It allows me to walk without having pain. I used to really like walking miles for my exercise, but then I would pay for it, or even exercise and then pay for the hip pain. Percentage change, 99%. Yeah. I still have to remain aware of it because I had scoliosis, but I believe even the scoliosis is improving. The second one was fatigue. Yes, and when you have right hip pain, you try all night long to be very proper so it keeps you awake all night long. Now I just sleep and allow the natural rolling that I need to in bed to happen without waking me up and making me lose sleep all night long. So I wake up and I'm refreshed and not exhausted before I even get up. And so the fatigue is 99% improved too. But I also think that the positioning of the bone structure from the appliance has improved to where the actual sinus cavities aren't feeling collapsed and narrowed on that left side. And I really feel like it's not pinched, and I breathe much better, and it all folds into giving me less anxiety and less fatigue and better air. Oh, the sinus clogging is much improved too. I'm not having to use all the, possible Western ideas that I can have to spray up my nose. Another one was clear. So, quality of life, 99% improved. No one wants to have 3, 4, 5 sinus infections a year. I still have allergies, but I can feel normal nasal, drip, and it doesn't block anything. And that is just 99.999% improvement in the quality of life. Anxiety, all focused around, well, what can I find at the pharmacy to alleviate all these issues? Am I going to have to go to the chiropractor? Am I going to sleep tonight? Because if you don't sleep, that actually affects your health and your mental outlook. Oh, 99.999% less anxious. But I was adjusting to, I just felt exhausted, and I felt, my tension headaches that would go all the way down the left side into my arm to where it would numb if I walked very far. When I walked, I would, shake it and, get it to, feel a little bit better for a few steps, maybe a block, and then I'd have to stop and adjust it. Or on my walks, I would have to, I thought it was because my quads were tight. It helped when I stopped every few blocks and stretched my quads, but then everything would tighten up in my entire, off alignment. And I just dealt with that. And it was, frustrating, but I was still forcing myself, and actually been told by my chiropractor that I dragged my left leg, the scoliosis. That may have been, definitely probably was, all related to coming from a structural imperfection here, to where it fed all the way down. And I've been stretching my calves, and I am able to stretch my calves, which were always knotted, way better because of the alignment coming from the head down is really helping me be able to get the rest of my spine in alignment and actually improve some of the scoliosis issues. If this is not fixed, you can work on the spine all you want, and it's going to kind of go right back to what it has to settle into. Oh, I am noticing that you know, as I'm walking, I don't have the knee pain, the hip pain. The arm is no longer getting numb when I walk, and I feel like I'm actually using the back portion of my leg muscles as opposed to just the front portion of my leg muscles dragging me. There are so many things about my walking, and it's actually enjoyable. And I feel like I'm exercising well and healthy as opposed to grinding my bones. Well, the airway is just tremendously more clear than it's ever been. So that is just such a tremendous, I feel like I'm getting more oxygenation as I sleep to exercise and enjoy my walks tremendously. Well, if you're having to see a chiropractor once a month, perhaps there's something else that needs to actually be looked into. And if you're having headaches all the time and popping a leave for them, you know, maybe there's something else you can do that is causing the headaches. I thought it was allergies. I thought it was, you know, that I was maybe, you know, looking at my computer too much, which is probably not good. But it was really based on the, you know, physiological structure that is, there's just so much difference and so much improvement. So I would tell her, you know, look into, there actually can be something done, and you're not too old either.